if this baby's coming to see me, they can also live without me. I'm not a medical professional trying to diagnose some type of chronic or serious illness. I'm enhancing that baby's life. I'm not saving it. So that takes a lot of pressure off, you know? Of course, I want to do a good job and I care, but babies do grow out or adapt to almost all of the problems that we're going to see in our offices. So we're kind of there to support and to be an adjunct. So, that that takes us down and makes us feel a little less triggered sometimes. Another thing that keeps me very, very calm, and I used to feel quite nervous until I learned about birth and delivery and the problems that come with birth and delivery. So there's a couple of reasons for that. So that would be, I would say, the second thing that I learned. I didn't start with that when I got into treating and specializing in babies. I actually started with pediatric cranial courses. Then I realized I have to stop putting off not knowing some of the general things that happen in the birth and delivery room because, well, first of all, it does help you diagnose faster and you'll know where to go, like first and then second and so on and so on. As soon as you see like certain things listed in the intake, just on symptoms that you've asked the parent to fill in on the chart. So it saves time. And then it increases confidence for the parents because they're seeing in your face, you understand the terms that they're saying. They might bring up some things that you've never heard of, but when that happens, because you know most of the other things, you can say, oh, actually, I've never heard of that. Can you just fill me in? Or I'm going to, look into that a little bit more later. So it's a confidence booster for yourself and for your image with the parent. So another thing that keeps me ready to take on babies is collecting names of professional people around me to start handling the things that I think are not in my scope. What I started to do is pay attention and jot down the names of practitioners that the parents would mention to me. So dental release providers that do tongue tie releases, good lactation consultants that'll do home visits or in-office visits. Check in your area, do Google searches for places that do pediatric physiotherapy because that is really important to be able to refer families to because I really don't know how to tell a parent how to get their child to crawl in a way that's more functional for them. There's tricks for that. There'll be games to play that the parent can do with the child. So it feels really good to know that, your scope is a certain thing. And then I've got this list of names or go see this person or that person to move forward with this other problem that you might have. Next is we want to keep baby calm.